Is lycanthropy a real disease? Imagine a world where people believe they can transform into wolves. This fascinating concept is known as lycanthropy. But is it a real disease? Let's break it down. From an anthropological perspective, lycanthropy is not a disease in the traditional sense. Instead, it is viewed as a cultural and psychiatric phenomenon. Throughout history, many societies have shared beliefs about human-to-animal transformation, particularly into wolves. These beliefs are often tied to folklore and cultural identity. In the realm of medicine, there is a rare condition called clinical lycanthropy. This is a psychiatric syndrome where individuals hold a delusional belief that they can or have transformed into an animal, commonly a wolf. Clinical lycanthropy is classified as a form of delusional misidentification syndrome. It is often linked to underlying mental health disorders such as schizophrenia, bipolar disorder, or severe depression. It's important to note that clinical lycanthropy does not involve any physical transformation. Instead, it is a psychiatric symptom that affects how a person perceives their body and identity. Neurologically, this condition may involve unusual activity in specific brain areas that govern body image and the sense of one's physical form. Neuroimaging studies have shown that individuals with this syndrome genuinely perceive changes in their bodies, indicating a neurological basis for their delusions. Historically, lycanthropy has been interpreted in various ways across different cultures. In ancient Greek medicine, it was described as a melancholic condition with symptoms like restlessness and wandering at night. This was often linked to imbalances in bodily humor rather than any supernatural transformation. Medieval Arabic medicine adapted these ideas, sometimes substituting the wolf with other animals, showcasing how cultural contexts shape interpretations of the syndrome. Anthropologists view lycanthropy as an example of how cultural beliefs influence the experience of mental illness. The syndrome is considered culture-bound, meaning its expression and understanding vary significantly across cultures. Treatment approaches often combine psychiatric medication with culturally sensitive therapy that addresses the individual's narrative and belief system. In summary, lycanthropy is not a real disease involving physical transformation. Instead, it is a rare psychiatric syndrome related to psychosis and cultural factors. Anthropology examines lycanthropy as a way to understand how human cultures interpret unusual mental experiences, blending medical, psychological, and symbolic dimensions.